Once again, thank you very much for coming to this second session that is being held in this particular room on inclusive growth. My name is Oliver Chinganya from the African Center for Statistics, and I'll be chairing, or rather moderating, this particular session of distinguished panelists. The session is on inclusive development. Since yesterday, I think we've been discussing about some form of inclusiveness, and I think the focus yesterday was on gender and how to ensure that women participate or are part of the labor market and so forth, and this issue about no one leaving behind. But I think inclusive growth, rather inclusive development, is much, much broader than just limiting it to gender participation or indeed to gender dimensions. And therefore, I think we should be looking at a much, much broader. And I'm hoping that the panelists that are with us this morning were able to take us through and much more elaborate in terms of how they understand and how they would like us to define this term, inclusive development. As a way of introducing, I'm just going to start with the person that will be the first panelist and give a very, very short biography of each one of them. In that order. So I'll start with Jonathan Marskell, who is an operations officer from ID4 program at World Bank Group. Jonathan is an operations officer with the Identification for Development ID4 program, where he focuses on advancing engagement and support in East Africa and the Asia Pacific. Before joining ID4D, in 2016, he worked for 5 years on identification, civil registration, and vital statistics in Asia Pacific with UNESCAP, UNICEF, UNHCR, and IOM. He holds a Master's of Arts in International Political Economy from King's College London and a Bachelor's of International Business from Marskell University in Sydney. The next speaker will be Amitabh Suthar, an epidemiologist from CDC Center for Global Health. Amitabh is an epidemiologist working with CDC Center for Global Health. He focuses on clinical surveillance, utilizing infectious diseases, case reporting, electronic health records, and vital statistical systems. He completed his public health training at UNC Chapel Hill. He has experience in the private, non-profit, multilateral, and government sectors. He has experience working in 9 low and middle-income countries. He has 30 scientific publication and contributed to about 15 WHO guidelines spanning on health financing, service delivery, health policy, disease surveillance, and medicines. Then we have the next speaker is Laetitia Bazzi-Veil, who is the Chief Child Protection at UNICEF based in Senegal. She has been head of the Child Protection Section for UNICEF Senegal office since April 2016. Prior to that, she held the same position in Cote d'Ivoire between 2009 and 2016. She is a legal trainer, a graduate in international public and European law, as well as in political science, with 23 years of international experience in child protection. Before joining UNICEF, she worked for several years as an international consultant on child and social protection as part of technical support missions for the development of surveys and research, evaluation of programs and projects, the development strategies, policies, and programs. Then we'll have the next speaker, who is Kristen Wenz, Child Protection Specialist and Global Civil Registrations and Legal Identity Technical Lead at UNICEF based in New York, HQ. She's a Child Protection Specialist and Global Civil Registration and Legal Identity Technical Lead. She brings extensive experience from across several technical sectors across North America, Africa, East Asia, and Europe. She has worked in the private sector as a legal and regulatory business analyst for a top Fortune 100 firm. She previously consulted for World Bank and supported the content development on CRVS e-learning courses. With UNICEF in New York, she was a consultant in health section supporting UNICEF engagement in several of the Secretary General's initiatives under the Every Woman, Every Child, including the Commission on Life-Saving Commodities, 16H, and the Every Newborn Action Plan. In Asia, and this is in East Asia and the Pacific, she was the regional technical focal point for the birth registration and representative of UNICEF as a member of the Regional Steering Committee, and supported the development of the Asia-Pacific Regional Action for Civil Registration. Kristen holds a master's degree from University of Columbia, a bachelor's degree from the University of Vermont, and a recipient of the Harvard USAID Global Health Fellow Program in Washington, D.C. and Malawi. While at university, she was also a member of the Montauk Board and the Phi Alpha Honor Societies, as well as the National Society of Collegiate Scholars, McNair Research Scholar, and UNECA Research Scholar, and the recipient of Benjamin A. Gilnam and the Honjo International Scholarships. Our last speaker this morning is Rikke Hansen, who is the Chief Economic and Environmental Statistics at UNESCAP. She has worked for the United Nations for 18 years in the areas of sustainable development policy analysis, program management, evaluation statistics. Rikke currently oversees work on economic and environmental statistics at the UN Nations Economic and Social Commission, Asia and Pacific, which is ESCAP. She first joined ESCAP Statistics Division as head of Statistical Information Services and was in this capacity part of the team that initiated the Asia-Pacific CRVS movement. Earlier in her career, she worked for the Danish government, including its statistical system, producing annual energy and emission statistics. She holds an MSc in mathematics and computer science. So you can see how rich the panelists that we have this morning, and I'm hoping we will have a very engaging discussion. And at some point, I also understand that we may have people calling in for the particular session. And you can see the interest that this particular session has drawn. And therefore, without further ado, I would like to invite Jonathan just come to the podium to be our first speaker. Please join me in welcoming him.
Good morning, everyone. May I please start by thanking the Centre of Excellence for the invitation to speak. It's certainly a real pleasure to be here in Ottawa for the first time, for me at least. And certainly it's a partnership that we very much value. Actually, I'm feeling a bit nervous because on the panel is my former boss for 3.5 years, Rikke. So if I'm a bit shaky, that's why. She's a great boss, a tough boss, but I love working under her. Anyway, so as you can see on the screen, my presentation is about the role of civil registration and ID in increasing access to services. And the premise of my presentation is that transactions of any kind between people, between a business and a person, between businesses, between devices and things these days, it depends on trust between those parties. And part of that trust is about establishing and trusting each other's identity. Now, historically, people have gotten by because of familiarity or vouching. That, Rikke is my former boss. Can you please give her something? Or I've showed a paper birth certificate. It may have some security features on it, and that was taken at face value. However, in today's age where societies are becoming wider and more digital, new mechanisms are needed. You have some examples there of computers, phones, globalization. And if we don't create these new mechanisms, we risk deepening the digital divide amongst people and ultimately exacerbating exclusion. So the situation now is, as mentioned this morning, the World Bank estimates that there's 1.1 billion people around the world who have no form of official ID. They can't prove who they are officially. And many countries have CRVS and ID systems that are not fit for the purpose I mentioned earlier for today's age. They're fragmented, including CRVS and ID systems. But data of different types will come from different sources. They're insecure. They're poor quality. So the data is in there is junk. So whatever comes out of it is junk as well. And they're paper-based. So if you want to obtain it, you may need to go to the capital city, a replacement birth certificate, and the searching is an absolute nightmare. To give you an idea of the situation, as I mentioned yesterday, the World Bank has included a few questions in the 2017 Findex survey, which covers 98 countries on identity. And for those countries that have a national ID, we ask, does the country have do you have an Aadhaar number? Do you have a Kebele in Ethiopia, for example? But for those countries which don't have a national ID system, we had nothing to ask them about. So we asked them a tailored question, which was, have you been denied one of these services as a result of lacking an ID? And as you can see the results here, and these are preliminary, so they're subject to change before we publish them. And certainly they're disaggregated, they can be disaggregated by age, gender, urban, rural, and wealth quintile. But you can see here, for example, in the Central African Republic, where there's been lots of conflict, the civil registry is not functioning, a lot of people have been denied services, at least a quarter, if not a third of people in a variety of services, and in particular, SIM cards. Now, to register a SIM card, you often need to prove who you are for know your customer purposes. In many cases, that's because of law enforcement or national security purposes. In other cases, it's because the SIM card is also used for mobile money transactions, and thus for anti-money laundering purposes, you need to reliably prove who you are. And you see the other countries. If I take the Philippines, for example, so SIM registration is low because there is no mandatory SIM registration requirement. But you see there, to access a government service in the Philippines, anyone who's been to the Philippines knows their motto is, their tourism motto is, it's more fun in the Philippines. And certainly when it comes to ID, it is more fun because there's over 30 of them. Every single program issues their own ID. And in fact, the Bank Central Filipinas accepts 28 of those IDs for regulatory purposes for KYC. So there's no shortage of IDs. However, you can see here that although there's many IDs, the many people are denied a service. Maybe it's because those IDs are not good quality. Maybe because there's so many of them, they're paper-based, they're destroyed, or whatever it is. So that's interesting. And then you have a look at Tanzania, which has just introduced a mandatory SIM registration requirement. Again, nearly a fifth of Tanzanians are denied a SIM card because they lack an ID. And you look at Jamaica, for example. Jamaica is low because they have a voter ID card. And that voter ID card is accepted for a large number of transactions. Now, what is the role of this in terms of inclusive development? Well, integrated CRVS and ID systems have a fundamental role to play because they increase access to services, but importantly, they can also transform how services are delivered. First of all, they provide a reliable underlying information system. This, in particular, is the population database, where you source someone's name, their date of birth, or whatever information it is that's needed. Second, they provide the ability to authenticate an identity, and ideally, that's anytime and anywhere. Third, they facilitate interoperability and auditability. Now, interoperability is, for example, through a unique ID number that everyone has, and that allows records of that person to be linked across systems. Auditability is important because you want to trace, number one, what data is being used, what the data has been used for. And for example, in social protection programs, you want to make sure that you're giving cash transfers to the right people, and you want to track over time what assistance that they're accessing. Now, the impacts, as you can see here, there's 9 I've highlighted, but there's many more. There's the digital economy, education, public administration and good governance, regular migration. So people historically cross borders just for the sake of it. In many parts of Africa, the borders are porous. We saw from the video this morning that Haisham played that for many, a passport, which is the traditionally accepted ID document, is expensive and quite cumbersome to access. A passport may be good for somebody to go from Tanzania to the UK, but should it be necessary for someone to go from Tanzania to Kenya to buy some eggs or some booze if it's cheaper there? Now, ultimately, all of these things lead to achieving the Sustainable Development Goals. We've heard many times about SDG 16.9, but from our perspective, from the World Bank's perspective, we see this as an enabler for almost all of the Sustainable Development Goals. Now, fully realizing this potential depends on the integration between CRVS and ID. I know that's going to be something I'm probably going to get questions about from this audience, but I want to emphasize that we fully believe that these systems need to be integrated. Now, why do you want to integrate? Well, first of all, you want to capture births and deaths as they occur so that you have a real-time flow of people who are coming into this world and out of this world. That ensures that the system, the database, is kept accurate and up to date. Second, the civil registry, ideally, is the authoritative source of biographic information. It's where you get your legal name, your legal date of birth, where you're born, and other facts, for example, that may be important for establishing nationality. Third, and we've conducted some research on the costs of ID and CRVS systems that we're going to publish soon. There are very significant cost savings when you integrate these systems from sharing the infrastructure. What this means is sharing offices, sharing staff, sharing software, these kinds of things. Now, how is this done? Well, first of all, unique digital identity needs to be created at birth, and that includes issuing the unique ID number at the time of birth registration. Second, deaths need to be reported in real time to not delete the record in any ID or population registry, but to notify it whether that record needs to be locked or deactivated. Third, like I said, the shared infrastructure. Now, I'm going to highlight some impacts that we've seen in some countries. In Thailand, where I worked for a number of years, and I'm very happy to see Dr. Bunchai here, the system of identity and CRVS is fully integrated. It involves the registration of vital events, it involves household registration and the ID system. And it's a very, very powerful tool for public administration there. There is universal coverage of births and deaths. And in particular, I want to recognize a lot of the efforts of Thailand to register marginalized groups, such as refugees, stateless populations, and migrants, of which there are many in Thailand. And importantly, the PID, which is the personal ID number, and the national ID card are used across all services. And so there is a strong incentive for people to have it. Now, what has been the impact? Well, first of all, in the early 2000s, when the government wanted to introduce universal health insurance to guarantee subsidized health insurance for everyone in Thailand, what they said was, anyone who's registered in the national ID database, you're covered. And then everyone who was registered in the civil servant database or the social security database, which was a voluntary system, we have your ID number, so we're going to exclude you from the full database so that you're not duplicated. So they know how many people are covered in their universal coverage scheme, and this is linked to the civil registration. As Dr. Bunchai mentioned yesterday, as soon as a baby is born, they're covered under the health insurance scheme. So there's an incentive both for the hospital, but also the parents to register that baby's birth as soon as possible. Then there is the plugging leakages in social assistance. So recently, 14 million people in Thailand registered to receive a government subsidy card for 3,000 baht roughly, up to 3,000 baht, less than $100 a month. The government was quite shocked at this number. They used the national ID number that was reported by each individual. They cross-checked it against some very simple databases. Number 1, bank account holdings. Number 2, bond holdings. Number 3, other social protection schemes. And they were able to eliminate 2.4 of the 14 million from that list because they were ineligible according to the conditions of that program, right? And in the process, in terms of savings in 1 year, $150 million or thereabouts. And then, of course, there's the real-time statistics. The Ministry of Interior of Thailand publishes statistics by age, gender, whether they're a citizen or not, at the lowest levels of the country. And this is shared with all government departments, and it's used for a variety of public policy purposes. And then, of course, there's India. Since 2010, through the Aadhaar program, they've managed to register 1.2 billion people. And you know, if you think about the scale of that, If that can be done, then fixing CRVS should be easy. There is weak integration between the Aadhaar program and CRVS. However, there are pilots and policies underway to address that. Importantly, the Aadhaar program revolutionized this topic of digital identity because, number one, there's no card. It depends on the number. Number two, it's residency-based. You don't have to be a citizen. You just have to live in the country for the previous 6 months. Three, it's an open platform. Anyone, public or private sector, can use the Aadhaar program to authenticate individuals. So it's not restricted just for government purposes. Now, the impacts, at least 73 million new bank accounts have been opened instantly simply by quoting a number and scanning a fingerprint. This meets the KYC purposes in India. It allows somebody to open a very basic bank account, and many of those 73 million accounts were for people who haven't had bank accounts before. The costs of onboarding customers for the banks in India has gone down dramatically, so there's new incentives to go out and offer financial services in rural areas to people who previously weren't commercially attractive. Second, they're creating a whole vast, unimaginable array of digital economy markets. This India stack that they've developed, which includes cashless payments, presence-less authentication, digital signatures, the DigiLocker, it's creating new services and creating an environment that facilitates innovation. Third, it's enhanced the integrity of social assistance. There's lots of estimates that say that very significant amounts of money in India were wasted in the very large social protection schemes that they have. This undermined the trust that people had, the taxpayers had in it, the politicians had in it, et cetera, et cetera. And by cleaning up those systems through biometric authentication and establishing uniqueness, they were able to increase confidence in that program, in the social protection programs, and create fiscal space that allowed the expansion and the increasing the assistance that is provided to those who are indeed poor. Now, I know time is running out, so I'm just going to very quickly show here two other examples. In Peru, again, CRVS and ID are integrated, and this has facilitated, for example, the establishment of a child registry, which access is provided to municipal governments who are able to track vaccinations, for example, and other healthcare services that are targeted at children. And in South Africa, because they use their national population registry as the basis for voter registration, they don't have to do a voter registration drive every time an election comes. And between the years of 2010 and 2014, compared to previous years, they managed to save around $230 million. Relevant trends and innovations in this space. You'll see here, this is a new report that we published today about the landscape of technology for digital identification. First of all, civil registration and ID credentials, the cards, the certificates, etc., are moving from physical to digital. And those systems are being built as platforms. Sorry, can you press the thing? Thank you. Systems are being created as platforms, not as systems. So other systems can talk or can build their own functionalities on top of civil registration ID systems. Second, there's an increasing use of biometrics, including for infants, and certainly it's really good that UNICEF is going to be doing a lot of research on some of the ethical, legal, and practical issues associated with that. More countries are issuing IDs to children. Thailand issues theirs to 7 years old. Peru from the day of birth. Senegal is introducing child ID cards. Indonesia's introduced child ID cards. Malaysia's got child ID cards, etc. There's an emerging multifaceted role for mobile as well. Mobile is not just going to be an ID in itself. Of course, it plays a role in registration, but all of these functions that are built on top of the ID. Then there's alternative sources of data and trust. We're going beyond government-run, operated, controlled systems to an increasing role for the private sector, and certainly distributed systems, such as those based on distributed ledger. There's a lot of work being done to explore those. So in conclusion, the messages that I have are here. Well, first of all, CR and ID systems are critical for delivering and enabling access to services, and digital identity is transforming this. As societies become wider and more digital, we really risk excluding the poor and widening that digital divide that I mentioned earlier. And so there is a need for more innovation, particularly from this CRVS group, and truly multi-sectoral approaches. And that involves, as I mentioned yesterday, working with the use cases, not just the health sector, the registrars, and the statistical officers. We need to go broader than that. Then, this is really fundamental, there are significant privacy and data protection concerns here that are not being addressed in many contexts. And this puts a lot of risk, particularly on vulnerable populations. And I think this needs to be a high priority for governments, for development partners, for civil society, and for people as well. So thank you very much. I look forward to questions.
No, thank you, Jonathan, for a very illustrative presentation. And the issue that we touched on, the potential of this integration of ID and CR, as well as the impact and which you have demonstrated in the various countries that you've had these several case studies, and I think these are things we need to follow up. So let me welcome Amitabh. Please join me in welcome to the podium, please.
Good morning. Thank you very much, Mr. Chair. Thanks also to the conference organizers for the opportunity to present this morning. I'll be presenting on a systematic review of policies to improve birth and death registration. So I think the panel this morning actually did an excellent job in setting the context of why we're all here and why vital statistics systems are really critical to development. And so I won't go into too much depth there. But as we know, the registration of these events, whether they be birth or death, do involve routine processes, which include the biological event, the notification of the event from that person's family to the government, and then, of course, the registration of this event into official government statistics. Death also encompasses another step, which is the cause of death ascertainment. This could be due to HIV, ischemic heart disease, motor vehicle accident, but I think this cause of death ascertainment also gives countries a better idea of what the burden of disease is and helps planning and budgeting in that respect. So the focus of this review is really to understand how we can help translate the biological events which are happening into registration into official government statistics, and of course use these for planning and action. So in order to tackle this review, we conducted a systematic review. We worked with our librarian to search the following databases: ABI-Inform, Embase, Gestor, PubMed, and WHO Index Medicus. We also contacted focal points at these agencies and multilateral organizations: CDC, UNICEF, UN Statistics, World Bank, and WHO. And 2 of our team members independently screened titles and abstracts that were identified through these databases against our eligibility criteria, which I'll describe in the next slide. And then we also had a 3rd investigator involved in case there was some disagreement. And the same 2 investigators then extracted the data from relevant studies on the setting, the design, the policy intervention, and the quantitative and also qualitative outcomes. And in order to synthesize the findings, we categorized them by policy mechanism. And there are many frameworks that can be used here, but for the purposes of this review, we focused on supply, demand, requirement for government services, punishments, incentives, and any combination of these. And I'll actually define how we conceptualize these in a couple of slides. And we did summarize them quantitatively and qualitatively based on these different policy mechanisms. So here are our inclusion criteria. Our population was any that was eligible for birth or death registration. Our intervention was a new policy, which we defined as novel legislation or change in program implementation designed to improve birth and or death registration. And the comparator was the lack of the new policy. We had several quantitative outcomes. These included birth registration rate, death registration rate, timeliness of birth registration, timeliness of death registration, and also a lot of qualitative outcomes, which we called operational considerations, and these included acceptability to persons who are registering the births or deaths, the acceptability to staff who are managing and implementing the birth or death registration system, human resource requirements, costs to the health system, adverse events, and facilitators or barriers learned during implementation. Our time period was from 1991 onwards, and we included cross-sectional cohort, case control, and randomized control trials for our quantitative outcomes, and also case studies and evaluation for our qualitative outcomes. So here again, there's lots of different ways that we can categorize policies which are designed to improve birth or death registration. And this is just one that we use for the purposes of this review. And even within this, I think there's different ways to interpret how to categorize. But again, this is just a framework that we used in order to help synthesize our findings here. And so our first category was focused on supply, and this was increasing accessibility of registration services. Our second was demand, which was focused on increasing awareness for registration through information, education, and communication. Our third was requirement for government services, and this was the requirement for a birth or death registration to access certain government services. Punishments was our next, and this was some sort of punishment for failing to register a birth or a death. And incentives, which was providing a reward for registering a birth or death, and a combination was at least two of these categories in one cohesive implementation. So there are several different phases of this systematic review. Our first was the identification of all relevant literature after conducting the search, and this identified about 10,000 abstracts. We removed our duplicates and then also those articles which were published before 1991, and we're left with 5,600 titles to screen. And we then screened those that were clearly not relevant to this topic, and we're left with about 1,000 abstracts to review. And after screening those abstracts, we were left with about 500 full texts to go through. And after applying these full texts to our inclusion criteria, we were left with 33 articles. After reaching out to a lot of the focal points at different agencies and organizations, we identified 2 additional gray literature studies, and we had a total of 35 that were then included for this review. And these 35 studies were conducted in 25 different countries, and you can see here there is representation in the Americas, Africa, Europe, Eastern Mediterranean, Southeast Asia, and Western Pacific regions. So of these 35 studies, 17 reported some results for supply or increasing accessibility, and these represented all regions, and we had also 13, which was the second most common category for a combination of different interventions, 1 for both demand and punishments, and 3 for a requirement for government services. And I did want to put an asterisk there for incentive, although we didn't find any that focused exclusively on incentives. I think there were several that looked at incentives in combination with a different policy category, and so we included those within our combination category. And the implementation of these articles ranged from 1990 to 2014, and they included births, deaths, or a combination of both. So of the 35 studies, 17 reported some quantitative outcome. And I'll start first with supply, those that were focused on increasing accessibility for birth registration rates. Some sort of supply intervention did improve birth registration in 1 and 2 studies. And for death, it was 4 of 5 studies that improved death registration rates. But I did want to kind of highlight this one study that didn't find a positive effect for birth or death registration. It was from Tanzania. And I think it's a bit important to contextualize why that was the case. They actually found that it increased notification by about 10 or 15%, but that increased notification didn't always translate into increased registration. And so I think the inference here is not that supply categories or interventions won't improve registration of events, but that we need to look at this from a holistic perspective and ensure that we're tackling the whole cascade from notification, registration, rather than just focusing on single steps. And then our next category was for demand, and we did find that demand did improve death registration in a single study. Similarly, a requirement for government services improved birth registration, and punishments did not have any effect for birth registration in a single study that published that outcome. And I think the most consistent and uniform finding was for combination strategies, which always improved birth registration or death registration in the 9 studies that reported this. And so now I'll dive a bit more into the operational considerations, some of our qualitative syntheses. And so of the 35 studies, there were 28 that reported an operational consideration. I'll start first with our supply interventions, those focused on increasing accessibility of services. And so Albania, Ghana, India, Malawi, Peru all reported that the first step was really having well-staffed, well-trained, and supervised human personnel in order to develop these supply-side interventions. And then studies from China, India, and Tanzania then I said that identifying the appropriate cadre within government to take on that task and then clearly defining their remuneration scheme was really critical to long-term success. And Albania, Ghana, Liberia, Malawi, Peru, Tanzania also reported that infrastructure, including connectivity and electricity, should be tailored to the local context in order to have continuous and successful data flow. And Ghana, India, Switzerland, USA found that leveraging sites already providing birth or death services for registration introduced resource efficiencies and also increased uptake. Ghana and India found this for birth registration, where they integrated registration into health facilities that were already providing services for pregnancy, including delivering births. And Switzerland and the USA found this for death registration in morgues, which were then integrating death registration. The last two are focused on community-based registration services. So Ethiopia and Tanzania reported that decentralization to community health workers may be insufficient for certain rural areas. And this was the case for those very sparsely populated areas which had just one community health worker responsible for a very large catchment area. So it was often difficult for them to, record the event for a birth and then travel a very long distance for another death. And so I think there is kind of a gap of what we can do in terms of innovation to see what other alternatives we have for these sparsely populated populations. And finally, China, Ethiopia, Malawi, and Mali found that community-based registration does fill a void where events occurring outside of a facility, but are also very costly. And I think this is an important finding for maybe those countries which are at the lower levels of birth and death registration and thinking through how to move up stepwise. I think as found by Ghana, India, and Switzerland and USA, leveraging those sites already providing birth and death registrations in the facilities is probably an important first step. And then once you saturate there and still have some areas which aren't accessing any facilities, then you could probably introduce community-based registration as an adjunct rather than relying exclusively on community-based registration services. And so the next one I think is very closely aligned to one of my panelists' presentation just before me, which did find from Botswana, South Africa, and Thailand that national ID number provision at birth did help improve available personnel and infrastructure for registration. And the last category that reported on operational considerations was the combination category. And so as expected from Bangladesh, Brazil, India, and Peru, a multi-pronged approach targeted to the local cultural context allowed countries to address both accessibility and demand simultaneously. And both Gambia and South Africa reported that legislation requiring birth or death registration or requiring this registration for services was insufficient without increasing accessibility and decreasing the direct and indirect costs associated with the registration. So I think once again there we need to work with both the supply and demand factors in order to be most successful rather than just looking at one side of the coin, which is just the legislation or just the accessibility piece. And then India and Indonesia reported that enforceability of federal legislation can pose challenges to registration at subnational levels. I think, again, we need to really adapt based on the governance context in specific countries. I think in many, looking at the national level legislation, it would be important to revise this in order to have effects on birth and death registration. But in many others, I think the subnational level of government is actually more important. So I think we just really need to think through where we can have the most impact, working on national level legislation or subnational level legislation, or maybe even a combination of both. And then I think this was a point raised during the panel this morning, but Botswana and South Africa also indicated that collaboration between government, non-governmental organizations, bilateral and multilateral partners really increased resources and different approaches that can be used to improve registration. So I think that this is found also in the evidence. And finally, one from Brazil was that using separate registration and service delivery staff and infrastructure for registration at low volume sites was inefficient. So we did have several limitations for this review. The first was a publication bias. I think we did focus and summarize all those studies which did report something in the evidence, but many may not have documented their experience. And similarly, many unsuccessful policy interventions may not have been documented. And so I think there we're kind of limited to what we were able to identify. And the second was related to the sensitivity. There was no systematic way for us to search the gray literature, so we may have missed some relevant articles. And this was just because the databases for WHO, World Bank, UNICEF were all designed in different ways. And so there wasn't really one search strategy we could use uniformly in order to systematically identify relevant articles from these different databases. The third was that meta-analysis was possible. Initially, we had envisioned doing some sort of quantitative synthesis of looking at how different policy categories improved registration rates, but this wasn't possible because the numerators and denominators for registration were not reported, and so we have to explore alternative methods there. And the fourth was the generalizability. I think for our qualitative syntheses, we have to remember that our generalizability would be limited to settings with similar health system, sociocultural, and governance context. So in conclusion, first, the combination approaches tailored to country context did uniformly and consistently improve both birth and death registration rates. There was a dearth of data available on costing and also human resource requirements. And so I think moving prospectively, it would be important for all of our evaluation components of different strategies to include this type of component so we can be aware of how much this would cost us to scale up or even to consider in other country contexts. And the third is that many of the articles and studies had a short duration of time, but as we know, as we're implementing policies, this is often for a long period of time or even permanently. And so I think it would be helpful to have continued monitoring and evaluation to understand whether these effects are sustained over a longer period or if they continue to wane. And this can actually help inform practice not only in that country, but also in others. And once again, coming back to this kind of more holistic look at business processes, as evidenced by Tanzania, if we don't really contextualize or interpret the data carefully, we can come to a wrong conclusion. And so I think it may be helpful in the future for a lot of these different evaluations to actually look at different steps of the business process. So focusing on the notification, the registration, and then also cause of death ascertainment for deaths. And so it could help us understand whether one type of policy mechanism is more successful for notification, and then another policy mechanism is more successful for the registration of the event. And finally, I think there's been quite a bit of action in this area over the last 20 years, and so I think we were a bit surprised that there was just a fairly limited number that met our inclusion criteria. And so I think prospectively, it'd be very important for all of us who are working in this area to include some sort of robust monitoring and evaluation element to all of our implementation programs. That way, we have a better idea of what's working, what's not working, and hopefully we can achieve our Sustainable Development Goals for 2030. So thank you very much for your time and attention, and I'll be happy to answer any questions you have.
Thank you, Amitabh, and very interesting findings on the review in the 35 countries. I think that also suggests that where there are potholes, pitfalls, I think they need to be addressed differently in the possible studies that may be likely. Let me welcome our next speaker, with Laetitia, and please join me in welcoming her.
Sorry. Je vais parler en français. I will be speaking French to change the English as usual routine. So I'm thinking that the interest of this panel is the very broad field when we talk about inclusive development. So I will be presenting to you UNICEF's experience in Senegal, which aims to connect communities with the Civil Statistics Service. So some key figures. It's a small country, 13 million population. Half the population is below 18 years old, with 2 million children under 5. We have a births registration that's 70%, according to the latest data available, and we have a vaccination coverage of children under 2 that's about 92%. So we are measuring that issue of accessibility to civil statistics very well, and the opportunities that there might be through the healthcare system. But to give you an indication, you can see that in Senegal there are about 689 civil statistics centers, as opposed to 3,000 health services institutions. So we can see that there's an advantage to work with the healthcare system in terms of numbers. We have children in rural areas who have 1.4 times greater risk of not being registered, and poor children who are twice less likely to be registered. There's no there's no gender discrimination in terms of the likelihood of a girl or a boy to be registered. So this national rate of 70% hides some great disparities. You can see in red regions where half the population, more than half the population of children is not registered, in the civil registers. In orange, it's about in the 30% range, and the yellow and gray zones are those where the 70%, where it's much greater than 70%. So the zones where you have the lowest areas of registration in the civil service is not where the healthcare services are strongest. It's really a question of the distance to be traveled, also social, cultural obstacles, a question of proximity of the civil registry services and its quality that's at stake. You can also see that the regions where the registration rate for births is the lowest are also the regions where the healthcare services covered is the lowest also. So in terms of civil registering, it's obligatory under the law. There's no discrimination or restriction on the ethnic, religion, or gender angle. The father, the mother usually, or relatives, the health care agent can make this registration in the civil registry. It's based on a voluntary declaration, and that's very specific to the Francophone system. We're not in a system where services staff go to the population to try and collect this information and register the child automatically. It's a system that's based on a voluntary declaration, and the sanction is only in terms of traditional chiefs. So it's mandatory under the law, but only the traditional chiefs or village chiefs will be pursued if the parents or the relatives have not made the declaration in the 15 days after that. So the system that exists rests heavily on the parents, on the capacity of the families to register their children, and also with discriminatory practices towards women in practice. So a single mother will have great difficulty in going to register her child, and also a married mother whose husband is absent or is away will also face great barriers in registering her child, with little knowledge on the hand of the civil status staff who want to prioritize declaration by the fathers. And also something we have to look at, it's the question that goes beyond social cultural obstacles and the distances, geographical, economic, social cultural obstacles to access to civil registry. But one of the major issues about which we have not thought enough, it's the question of the position of populations in terms of state services. These civil services are not education or health services. It represents the state's authority. And you are in a context where the relationship with the state is ambiguous. The fact that one goes and declares a birth or a death to the civil registry, or marriage as well, has strong legal repercussions and creates an official bond with the state, has advantages, but also there's a perception of loss of freedom or flexibility. So it's this question of the state's authority and the relationship between the population and the public services has to be taken into account when you're trying to improve the registration. So briefly, just to say that when we're talking about strengthening the registry system, we have to focus on strengthening of the civil registry system itself with the institutional service, the quality of services, and the reinforcement of the healthcare system with considerations related to the capacity of the system, of the health agents, of the routine information communication, but also we have to have a stimulation of the demand. Even if you computerize all the civil registry systems in Senegal, if you don't work on improving the links with the community, few people will come and do it. So the technological improvement of these centers should not let us forget the question of the central role of communities. In terms of UNICEF, how will we build this bridge? There's several approaches. There is the raising of awareness, communicating information on the value of this, what the procedures are, what are the timelines for declaration. There's community mobilization. There's also the approach of strengthening the processes of detection and support for declaring information to civil registry through healthcare facilities. And there's also innovation, something that we call Rapid Pro. In terms of this information communication and raising awareness, there are several ways of working. The first thing is to have national communication about the plan for civil registration, which is led by the government at a central level. And one of the difficulties we have with that is the issue of prioritization of the messages. We focused over the past years on registration of births. There's a strong focus on birth registration, less on death registration, and even less on marriages. So we know that this approach must be adopted in a integrated, holistic way if we want to satisfy the CRVS objectives. Now that we're working on informing the population, it's all this paradigm and this relationship to the civil registry that must be built, and communicating what the advantages are of registrations, births, marriages, or deaths. The other element is community mobilization. When you know that you're in areas where people have to go 15 to 30 kilometers to have access to one of the first civil registry centers, then we have to focus on community mobilization. And also, people then are inscribed in a register. And when we talk about promoting this registration of civil registers, there's the aspect of governance, of security, of access to social protection. The undertaking here was to concentrate on the issue of protection of children. So we decided to use that. This organizes in a hierarchical way different methods of protecting children at the departmental level, at the community level. It's piloted by mothers, and in neighborhoods, it's piloted by village chiefs and neighborhood leaders. So we have to support and strengthen capacity, provide tools to the various actors in these structures so that they can inform the population, so they can also detect births in a periodic way, and also put in place mechanisms at the community level to monitor births and deaths in the community, and put into place a structure which collectively organizes the trajectory of information from the community to the civil registry. Also in Senegal, one of the particular aspects is the inclusive approach, the influence that of religious leaders. So we tried to take advantage of that, the influence of religious leaders on Senegal society. And there we're at the intersection of this agenda with the gender equality agenda. So we, for that aspect, we based ourselves on the strength of religious leaders on the issue of child marriage, for example. And so there are religious leaders who will refuse to celebrate a religious wedding if there's not a birth certificate that also says that the person was registered, and also provides the age of the young woman. So there are several programs that increase the demand at the community level. The other approach is to underline the contribution of the healthcare system. So in Senegal, we focused on birth registration by using routine healthcare services and also vaccination campaigns. Several tools were developed. First of all, the registration of births was integrated in the healthcare services notebook of the mother and child. And there are also informal structures put in place in terms of the healthcare measures. So they're not civil registry agents who are there or health care agents who work as civil registry agents, but a system for detecting and supporting children who have not been registered in the civil registry up to the point that they are registered. For example, we have campaigns for vaccination. There's a whole procedure that brings into play the community health agent who has to detect children who are under 1 year old. Because in Senegal, the registration in the civil registry in Senegal, in a classical way it's not punishable, is possible up to 1 year of age. So there's a possibility of following up with the child in the 12 months after birth. So the community health work will be trained to do this and will be equipped with tools to do it, to identify these children, to collect the information necessary for the declaration, and to send the information to the head nurse. And the head nurse will check the quality of the information and will transmit that information to the mayor, to the authority responsible for the civil registry, who will then register this and send the document to the civil registry, which then comes back to the nurse and the children. The third approach is an approach based on technology. You saw the first two approaches are focused on human work, on work processes, collaboration between various actors from different sectors and different levels. So Rapid Pro can link together all these actors in a simplified way and in real time. So it's a tool, a platform for sharing and managing information through mobile telephony, which aims to follow up on and to report on vital events, which will triangulate with the community level, the civil registry agents, the health agents, and community actors, as well as the central level. It's a tool that is aimed at facilitating communication and collaboration of these various actors. There are several functionalities in this system, and it's adaptable in different countries. Senegal opted for the 5 possibilities that are present. So there is a mode to support birth registration. So it's not a question of pre-registration because the laws there don't allow it, but to communicate the information from the healthcare worker to the civil registration worker and the parents on reminders in terms of the need for declaring a child. And also then there's the monitoring of the vital statistics. And there the health worker, the community worker, who notify or report on births and deaths on Rapid Pro. This information is available in real time in terms of the civil registration services and at the central level, and also on following up the inputs. So there's problems problems with stock reporting in terms of births or deaths. So Rapid Pro allows a monitoring of the stock with availability of information at the central level on an almost daily level. The third function is a function of coordination and sharing information by the central level towards the services at the regional and community level, and this can be used for follow-up after training. So reinforce the capacity of the healthcare services and the civil registry staff with the central level that sends them back information and does a follow-up after the training. The final element is the feedback and service delivery that can be operated by the parents in the community level. They can send back information that's visible from the service level on the quality of services, quality of the welcome, the respective procedure. So this tool has great potential, and Senegal is working at the development of the various flows of information. I'm not going to go into the details here, but it's a system of reporting both the basic data on the number of births at the community level, births and deaths, the number of births and deaths in terms of the healthcare services, and also number of births and deaths that are registered at the civil registry, and with an information circulation that will allow the identification of gaps and inconsistencies in terms of the number of events at the community level and those that are registered in the civil registry. So what are the limits and constraints? So generally speaking, in this whole approach, there is the electoral agenda. The civil registration is a political issue. It's an issue for election processes. The control of electoral lists, the person who controls the civil registry controls the electoral list. It's kind of a caricature of it, but we're in the dynamics of politicization of the civil registry, which slows down the work that can be done at the central level and also has an impact, a negative impact on access of populations and communities to the civil registry. The decentralization is also an issue. We have a tendency to see this as a pyramidal level where there's a central authority that commands, that supervises the functioning of the civil registry centers. However, in Senegal, it's not the case because the law on decentralization, this responsibility is that of territorial centers, which is a problem at the National Center for Civil Statistics, because there's a disconnect. The budgetization, the allocation of resources of the sub-areas depends on budgeting that is decentralized. Also, there are various configurations. Communes will put into place a computer program for registering this that's totally unrelated of that with their neighboring was. So a dialogue and involvement of the territorial communities is important. And just to emphasize the issue of inclusion and participation, it's the vision of the role that the health care actors play. There are dynamics of resistance and collaboration between the civil registry services and the health actors. The health agents consider that they already have a lot of work to do to ensure the survival of populations, especially for women and children, and see their contribution or possible contribution as being an extra burden. That's why funding based on performance with the integration of an indicator on civil registry would be important, because it would be additional incentive. But there's also the resistance of the health agents in terms of the emerging role of the health agents for birth registration. The other point is also that the over-investment that we have on reinforcing the healthcare sector's role has to take into account that these healthcare structures have to preserve a relationship of trust between user, patient, and the healthcare system. And given that we're in situations where the relationship with the state, with public authority, through including the registration at civil registry, can be problematic. So some health agents will say, no, it's too complicated. Oh, well, I don't have much time left. So simply there's this dynamic that must be taken into account.
So one of the major limits and constraints is the deficit of knowledge and data on demand. The MICS, the DHS, does not provide data on the extent. But we don't have any disaggregated data as well on demand. So we have to be able to work with census in order to be able to document the information so that we have a better representation at the national level. Also, everything that has to do with respect to the social, cultural aspects, and as well as the economy as well. This information has not been sufficiently documented either, and we have been working with the IRDC in this respect. So, in light of the experience from Senegal, well, first of all, I don't have to say it, but obviously the data for us, it speaks for itself, is that the health organizations play a key role in order to be able to obtain data from on the ground. Over the last 5 years, there are only 2 regions where we've had increased birth registration information, and those are areas where the health systems have provided or supported obtaining such information. So, for example, we've worked as well in terms of training civil registry officers in other areas and other departments as well. But we have focused in those areas where we focused on the health systems, that's where we've seen the most positive results. Of course, we need more financing to have more information, as well to have more evidence on demand. The other thing, and this is a lesson learned, is that innovations does actually not replace the requirement. Innovations do not replace needed changes in human work processes. So too much technology can only be built if there are established work processes and that these processes are clear and where everybody knows what their role and responsibility is. The technology cannot substitute such process. It has to be built on these processes. Thank you.
Thank you. Thank you, Laetitia, for that presentation on the overview on the work in Senegal, identifying the gaps, the quality, and also the mechanism that you are putting in addressing these issues. And let me go straight forward and welcome Kristen. Please join me in welcoming her.
Thanks so much. So when I was first asked to present on inclusive development, I was trying to think of what is the essence of that? What does that look like? And I was reminded of a time that I was in college, and I grew up in Vermont, and I went to undergrad in Vermont, and we get a lot of snow. And unlike New York, that they cancel everything in 2 inches, we get 2 feet, and you still got to go to class. So one morning I was traipsing my way through the 2 feet of snow, and I saw the custodian just shoveling the steps as fast as he could, and I noticed my friend waiting very patiently at the bottom of the steps. And I said hi to her and looked up at the custodian. He turned around and he said, "I'm so sorry. As soon as I'm done with the steps, I'll get to the ramp." So my friend, she used a wheelchair, so she needed to have that access there. So I said, "Sir, if you just cleared the ramp, we could all get to class." So that, to me, is the essence of inclusive development. It's shifting from your thought process to the majority, thinking about things a little bit differently so that we're not excluding anybody. This is really the heart of what UNICEF does. We ensure that children remain a part of the development agenda. Laws and policies are being put in place by adults, so we need to make sure that children still have a voice and that their rights and their well-being is reflected in that. And then, of course, with gender, it's mainstreamed into our work with our gender action plan, and it's a critical part of what we do. So I have kind of a hodgepodge of a presentation, which I was told was fine. So thinking about people. So we're trying to do a little behavioral economics, right? So think about some of the ways we behave. We're not really rational, even though we would like to think so. So when we have limited information, then the consequences are sometimes we don't really change how we behave. So thinking about quitting smoking. If you're not actually seeing the negative effects and it feels great, if you don't actually know, you don't have the data and science behind that, you probably won't change what you're doing. So status quo bias, we know that, we like to kind of go with the flow. We don't really want to stand out. So in countries that have really low civil registration, it's not really much of a motivation for you to then be an outlier or go and get your marriage registered or a birth registered when very few other people in your community have that. And then inertia. So this I suffer from a lot. It is definitely, you kind of just, it's the opposite of, you don't take a lot of initiative in things because it gets harder. So it's so much easier to be opted into something than having to make those extra steps. So we see this a lot in retirement or trying to make these choices. If you have to the action has to be to opt out of something as opposed to opting in, you can really see some results there. So instead of having birth registration be an extra step or 3 steps for the family, if it was just integrated into the process, so by the time you checked out of the hospital, all you had to do was confirm your birth certificate, this information is correct, or and it comes back the next day and you're good to go. Trying to shift things instead of making it more difficult for people to making it easier. It's a little bit of just redoing the system. And then the time discounting and present bias. We always have tomorrow. We like to procrastinate, unless you see an immediate reward. If it's me when I go running in the summer, it's always like, okay, so if I'm not going to lose a pound, I'm done. I give up. I'll try again next year. So being able to reward people for their behavior, and that's kind of the essence of the second half of my presentation, is what are the rewards and what are the incentives. So if you look at something like that in a context of South Sudan, a very difficult environment, why would someone in South Sudan who's facing ongoing conflict, health facilities don't have electricity, basic survival, when most of the government budget's focused on defense and security, there's really not much left for anything beyond bare minimum life-saving interventions, and even those are insufficient. The country doesn't have a legal framework in place yet. There's massive displacement. It's incredibly challenging. Here's a diagram of what the health system structure looks like from South Sudan. So this is done by our Juba office. And they're showing just the different challenges and the barriers and the different processes to go through. There's one really good state hospital, and that doesn't have electricity at all, and it's a fully paper-based system. And so what are the influencers? What do we want to look at? So there's different levels of influence depending on the part of the system. So we know that the senior government officials have a lot of push in policies, but they change often. So you can spend a lot of time, you spend 2-3 years working with the government, getting them on board. They're pushing the agenda, and then all of a sudden somebody new comes into power. So you have to start over again. Leveraging the schools and the hospitals, they have some reach, which is great. So one of the increases of demand for a birth notification is when kids go to school, because it's a requirement to go to school. And then looking at the social structure in the community, so the village chiefs are quite influential, and then also having the community volunteers and the midwives to create some of the demand. And then your peers as well. If your peers think it's a good idea, then you often get on board. And in South Sudan, the women don't really make the big decisions, and they don't really venture out alone. So it's really comes down to the father, if the father wants to register the birth of the child. So here's what UNICEF South Sudan did. They did a mass communication strategy to kind of generate this demand, but they didn't just do one layer. They did multiple layers to reach the community and the family, leveraging several opportunities and several ways to engage. And I hope you see how many women were reached as opposed to men, with at least creating the demand so then they can tell their husbands to go and do it when they get back from work. And this is kind of what it looks like. So they did a diagram of the process if you're born at home or in a hospital, and some of the barriers from lack of understanding or just not really seeing a use in it, and whether or not that results in your birth being notified. So now I'm going to switch gears. This was a report that I worked on with Sam Mills and Robert that's looking at what we came up with a supply and demand framework for birth registration, but then we looked at some of the incentives specifically on cash transfers. So the last behavioral was what kind of rewards can you give somebody to change their behavior? And this was kind of the impetus of looking at that. So we searched more than 200 articles, and 42 met the search criteria. So we know that cash transfers have pretty remarkable effects on alleviating poverty, and their reach is pretty substantial. So we have 149 countries that have various forms of these protection programs, and in these countries, they've been demonstrated to reduce inequality, increase health outcomes, reduce child marriage, increase girls' education. It's pretty incredible what it can do, but there's not enough. So countries don't really spend enough money on these programs. There's gaps in coverage, and that means there's a limited impact of overall poverty reduction. And there's the other part that almost all of cash transfer programs require some sort of identification to partake in them. So these are some of the barriers that we all know. We discussed them, of the supply, the policies that could discriminate against certain populations, the infrastructure, distance, all of these things that we tend to talk about often. But this is something that we don't talk about. The impact of having a birth certificate as part of your condition to get your cash transfer. So we saw in Brazil that it increased from 72 to 93, South Africa from 21 to 84, and in Nepal, 42 to 90. This is pretty substantial impact if you can link these two systems together. And then there's another comparison of the type of conditionality. So the administrative requirement is the highest, that has the best impact. But when you have a requirement, you have to also have something in place so you don't exclude the most vulnerable populations. So since the poorest and most vulnerable are least likely to have their registration documents or a legal identity, there must be a process in place to ensure that they can have if they show up, they don't have that needs to be facilitated quickly, which was a lesson learned from South Africa. So they noticed when they first rolled out the program that they were excluding, and they had a spike in very malnourished children, and they were trying to figure out what that was, and then they realized that these families were going that really needed these social transfers, and now they were denied the social transfers that they had, and therefore it actually negatively impacted them. So then they revised the laws and policies so that when the families came and they didn't have a birth certificate or legal identity, that they could actually receive one. So that's it. Thanks.
Thank you, Chrissy, for keeping into time. And I'll have to rush the last presenter if we can squeeze in the 10 minutes so that we have at least a bit of time of discussion. So Please join me in inviting Rikke to the podium.
Thank you very much, Oliver. And I think that just in a reference to the behavioral economy, maybe there's sort of immediate reward after this one in the form of a lunch. So there's something to look forward to. It's a pleasure for me to be here. I want to thank the organizers for inviting me. And I look forward to now presenting a bit of the Asian and Pacific CRVS decade, which is the initiative that brings partners, countries together in Asia and the Pacific to strengthen CRVS systems. Before I get fully into it, I want to just recognize the many colleagues, former colleagues, partners who are in the room, who really have been working together to get this initiative off the ground. And maybe I was wondering if this might be one of the messages to take home with us from this conference, and that is that when we talk about innovations, maybe we need to be a little more innovative in terms of partners for strengthening CRVS systems, because it's always very nice to see so many familiar faces, but I think we need some new faces in the room as well. So just on that note, I think it's been made very clear by the previous speakers that CRVS and an inclusive development agenda is very, very closely linked. And in terms of the initiative in Asia and the Pacific, I think that's probably best illustrated by the slogan that we came up with, which is the Get Everyone in the Picture slogan. And that is also very closely linked to the slogan or buzzword that's often used for the Agenda 2030, the Sustainable Development Goals, namely to leave no one behind. So although the initiatives in many parts of the world, including in Asia and the Pacific, started before the Agenda 2030 was developed, the thinking underlining these initiatives are actually very similar. It's not a complete coincidence. There was a lot of very successful lobbying from CRVS champions and enthusiasts around the globe when the Agenda 2030 was formulated, and that is one of the reasons that we see very, very clear stamps of CRVS in the Sustainable Development Goals. Now, although we talk very often as much about the data when it comes to CRVS systems, I want to just stress a point that I believe you, Haishan, also stressed this morning, that the raison d'etre for CRVS systems is really linked to the legal identity issue. We have a lot of other benefits that comes from successful, well-functioning CRVS systems, but I would want to refer to those as benefits. It's not the core. Now, a trip down memory lane. This is the birth certificate of the Asia-Pacific CRVS initiative, the decade. You may recognize some of the people on the picture there. For example, to those of you who were here yesterday, the woman who was giving the keynote address, Dr. Akhtar, is standing in that picture, putting her signature on the birth certificate for Asia and the Pacific. Now, the commitments that were made were threefold: a vision, a declaration, as well as a regional action framework. And the vision focused on the benefits from universal and responsive CRVS systems, with a very strong focus on rights, governance, health, and development. And this commitment was spelled out in more details with a framework for monitoring, and that is the Regional Action Framework. Now, just to briefly mention the goals that were set. 3 main goals, again spelled out in more details with indicators on various components. But the first of the goals is universal civil registration of births, deaths, and other vital events. The second goal focuses on the legal documentation to individuals of these vital events. And the third goal focuses on the vital statistics that can be produced and used on the basis of the registration systems. The Regional Action Framework, as I mentioned, has some goals and indicators, but just as important, it also has a number of implementation steps that all governments and partners agreed to back in 2014. And some of these steps really underline this need to have an inclusive approach to strengthening CRVS systems. I wanted to just highlight that part of these implementation steps was an assessment of inequalities related to CRVS, specifically looking at various subgroups of the population and a strong encouragement to set very specific targets and actions in place to address some of these inequalities. Another part of the implementation was through national CRVS coordination mechanisms to develop comprehensive multi-sectoral CRVS strategies. You're getting very impatient there. Oliver. Yes. I will make a few points. So, reward is coming up. Yeah. The status of this initiative, I should say that the initiative is monitored through different networks of partners, countries. So there's national, regional monitoring, and also reporting. And UNESCAP, where I work, is focusing as the, say, information hub for this initiative. And we have received 58 country reports. We know that 38 of these countries have established national coordination mechanisms. And I wanted to highlight this because we are looking at 58 countries that represent almost 2/3 of the world's population. So if we talk about inclusiveness, it's a major initiative. And if we see that 38 of these countries are starting to implement these various steps towards well-functioning CRVS systems, we are very well underway. And I just wanted to stress that point again, that we are not starting from scratch. I think we need to be much, much better at really picking, identifying and working with the champions that already exist for CRVS systems. I wanted to mention a few things in details about the progress that have been made in various countries in Asia and the Pacific. Political commitment, stronger coordination among the various departments that have to be involved in implementation is strong. There is a growing concern about the ID management systems. And there's a feeling that there's some political attention that's being diverted because of this. And I think this is maybe something we can discuss more today and tomorrow to find out how we can leverage some of the political support for ID systems to make sure that we also strengthen the basis for those systems that was already highlighted by Jonathan, that we need to look at CRVS and ID management systems together. We see improvement in terms of completeness of registration almost across the region, but I'm very happy to see that we've seen particular progress in South Asia and the Pacific, where this has been, the registration rates have been low. In terms of using registration information for producing vital statistics, there is a lot of work going on, and at least 13 countries I'm aware of are producing a vital statistics report on the basis of their registration records, and are now in the work to regulate this so that it can be disseminated as official statistics as well. So this is very encouraging. It's something that many partners are working together with UNESCAP and others to improve. Let me just finish here with a few next steps. On the agenda is to focus on the link between national ID management systems and CRVS systems. There is an expressed wish from the steering group that oversee this initiative that there should be a high-level midpoint review of where the status is at, so that we can use a big bash, a big event, to pop up and sustain the political momentum for the initiative. The work on the various aspects that have been mentioned this morning is carried through within the region through 10 task forces that each focus on very specific aspects of CRVS systems. And UNESCAP, as well as partners, are continuing to support countries on the production of vital statistics, as well as some of the aspects of improvement of the registration component. So with this, I will say thank you very much for your attention. There is much more information about work going on in Asia Pacific on our website. The link is on the slide right now. It's getinthepicture.org. There's a lot of CRVS knowledge on that page, so I encourage you to visit it. We have a newsletter as well. If any one of you want to receive the regular updates, just let me know, and I'll make sure you get on the circulation list for that. Thank you very much.
Thank you, Rikke. I know I sort of pushed you as the last presenter, but I didn't have a choice. Okay. I didn't have a choice. So we got into the end of the panel discussion, and I think we would have liked to have open discussion, but we won't have some 3 minutes before breaking. But I just want to ask if there's any question that has come through from those that are watching. At least we could ask. Okay, good. I'm told there is none. I think we've had quite a very good understanding of the various presentation, in terms of inclusive development. Some of them were also looking at the case studies, very specific case studies at country level in terms of the work that is going on, and also how they are making sure that these work are integrated and allows for this inclusive development. But I think there's still a lot of scope to discuss, and I think I would like to encourage yourselves in the next 1.5 days to sort of engage with the panelists here in terms of asking questions, given that we've run out of time, and that this discussion goes beyond just this room and also the conference itself, and somewhat perhaps what has been shared out there online, we'll be able to get some kind of a response. I know there were a lot of questions people would have asked Jonathan and also the other colleagues, but unfortunately we don't have that time. So made me just thank the panelists, for the wonderful discussion and very informative, issues that they've raised before us, and ask the audience just to give them a round of applause for the good work.